Joining me now to talk about that, the Democratic governor of Connecticut, Ned Lamont. Governor, thanks for joining us on this. Appreciate it. As of this morning.
Good afternoon, Yasmin.
Good afternoon. There are nearly 2,000 as of this morning confirmed cases in your state. Do you have the resources at this moment that you need to handle that?
We do right now, but we won't in a week. And what I tried to insist with the president this morning on the call, and I'd say the same thing to Joe Biden. Don't think about the epicenter as New York. Think about the epicenter as the New York metropolitan area. And that includes Jersey City, and that includes Southern Connecticut. Southern Connecticut has the same infection rate as most of New York City right now. And the border and the virus does not know any state borders. They really have to think in terms of hot zones, not states.
I got to say, that's not a great prospect of where you are at this moment, Governor, saying that you have enough supplies as of now, but in a week or so, you may not, considering the way the cases are multiplying in the tri-state area.
Yasmin, no question about it. We need ventilators. We need the PPE. It's being redirected at the tarmac and JFK and going to other states that are considered more at risk. We are at risk, especially in the southern part of our state. Right now, we have some capacity in the northern part of Connecticut. So as needed, I can take people upstate to free up critical care beds downstate. But that's a game that you can only play so long.
The president, as you well know, threatening quarantine of your state over the weekend. Why do you believe at this point that type of measure is not necessary? We have hundreds of roads and highways, and not to mention trains and other ways, in and out of our metro center all the time, New York, New Jersey, and Connecticut. It would just be an enforcement nightmare. And by the way, our train is almost empty. Most of our people almost all of our people are already staying at home. I think the president made the right decision at the end of the day with his strong transportation advisory, which is stay at home. And if you leave town, get yourself checked and self-quarantine. Right. So you're bringing up the CDC advisory that went out yesterday evening with regards to travel from New York, New Jersey, and Connecticut. But do you think that is going far enough, especially as you watch the cases increase here in New York City?
Look, what is going far enough is the social distancing. We've really got to be strict on those groups, especially those young people who are still clumped together and not respecting the 5 or 6 foot limit. Look, in terms of people coming in and out of the city or in and out of Fairfield County to the rest of the state, we are closing that down and people are doing the right thing.
What did the president have to say to you when you spoke to him specifically, if you could share?
What he does is we're on the teleconference, and he asks each governor to say what their case is. And my case was, don't think about New York as the epicenter. Think about the New York metropolitan area, including Southern Connecticut. And I think he said, let me think about that. Next, please.
What type of communication are you having with the local hospitals in your state to make sure they are not nervous, to quell some anxiety a lot of healthcare providers have right now, considering the lack of supplies in their systems and what is ahead of them?
We are in hourly communication with our hospitals, working together really close, adding on facility space, because that's something I can control. We've got thousands of nurses who have come out of retirement, so we're getting the people we need on the front lines. We created daycare centers next to each hospital so that they can be sure that their kids are being taken care of. These are things I can control. Getting ventilators is something I need the federal government to help out.
Can you talk to me about numbers here, though? Because as we've heard from Governor Gretchen Whitmer of Michigan talking about the numbers of ventilators that they need, the PPEs that they need in their state. Of course, we know about New York State and the needs here. Louisiana being another big hot spot. Florida, it looks like, is progressing in that direction as well. Georgia being a possible another hot spot, with Atlanta being there. Talk to us about the numbers of need that you have in your state at this moment and the likelihood that you will get it in the time that you need it. We put in our order very early on. We quantified that with a model. We said we've got close to 1,000 ventilators now, but we desperately need 1,500 ventilators in addition. We had that order ready to go, and at the last moment, FEMA redirected that elsewhere. They're saying we're near the top of the list. You got the emergency certification. We need that now. You know, ventilators are life and death. I was talking to a ventilator manufacturer yesterday. When you have severe COVID, it's like a 500-pound person is standing on your chest. So this is really now.
All right, Governor Ned Lamont, of Connecticut, thank you so much. Appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.